screen one. I hope you can be able to see it. So this is the final one. As I mentioned, so far we have covered 5 sessions. So this will be the last one, which is the project closeout. So here we will discuss in detail how we can be able to, how we can be able to transit the project that we completed to the end users, to the clients. So we shall discuss this. So again, this is the overview of the training module. As I mentioned, today we'll cover the last section of which is the project closeouts. The last one, it says HIS Information System Project Management Best Practice and Useful Tools. So I will leave this one for you to figure it out. We will be sharing the tool pack, the overall tool pack, and then later you can be able to explore it by yourself. But the most important part is, as I said, how you can be able to deliver the project that you completed. So we are here. So remember, we have project management tool pack, which I showed you during the first day and the second day in the form of Excel sheets. So in today's session, we will review in detail the project closeout template. We will cover some failures from the field and learn how to move, into the production phase. So this is in short the learning objective, which is to understand project disposition template and learn how to wrap up HIS information system projects. So we also want to, it doesn't have to be today, but we will send an email to receive feedback from you about the entire online course delivery. So that next, when we plan similar online course, we can be able to improve it further. So we'll be sending a feedback and then you can be able to complete it. This template has, a checklist, which are the bare minimum of things your project should address during this phase. So we're going to see the checklist, but just for you to remind, the closing phase of project management is the final phase of the project lifecycle. And this is the stage where all deliverables are finalized and formally transferred and all documentation is signed off, approved and achieved. And the project closure step also gives the team the opportunity to review and evaluate the project's performance to ensure future project success. So so this is in short what we can be able to achieve from the last phase, which is the project closeouts. Here is the checklist. As you can see, there are, sorry, I cannot be able to move. Yeah, just give me a second. Yeah. Okay. So the disposition checklist or the project closeout checklist has about 6 main components that we need to check. One is about the system evaluation and the planning. So you could ask yourself, has a formal system disposition plan that documents all the activities being completed? Has the impact of the system disposition system stakeholders been assessed? Have all technical independencies with other systems been identified? We need to check whether there is presence of hyperlink, and if that hyperlink is we have to check whether there is dependency with that hyperlink or not. And we have to also look for mitigation strategy for documentation, for all the technical interdependencies. And in relation to the communication, has all system documentation been updated to reflect disposition of the system? Has the user community been notified? So we have to notify to all end users about the schedule for the system disposition. And the other one is about data disposition. So we have to ask, has all system data been archived in the agreed upon formats? Okay. For instance, if we are implementing electronic medical record system, so if there is existing patient files, laboratory test results, radiological examinations, and everything, so we need to make sure that all the data are transferred to the electronic format, and then we have to archive those things, and then we have to plan to hand over, all the data. So we have to check on the data disposition. And the other one is, has all system data been evaluated to identify all applicable legal requirements for record retention? So if there is any legal requirements for data retention, then we have to check that. Has archival data been stored in the safe forever kind of backup area or designated data servers? So we have to make sure that all the necessary data are stored and appropriate backup are taken. And the other one is about software disposition. So here we need to ask, have all software library files related to the information system been archived, deleted, or transferred to other systems as planned? So this is something that we need to ask our service before we close out all the project activities. And the other one is documentation disposition. Has a copy of all current information system documentation been archived? So most of the time, this is what we have lacking, especially in developing countries. So we just leave, all the current information system documentation for users to figure it out by themselves. We don't really document it well. If possible, we have to document everything and publish it in a reputable journal so that others can learn from the experience. So that should be the first step that we need to take. If not, if we cannot be able to publish it, then we have to document everything, and then we have to deliver to the client or end users as a final, together with the final product. So we really need to document everything what we have faced, if there is any challenge that's identified, and if there is a way to resolve that challenge, then we have to document that so that it can be lesson for others. Have all system procedure been archived in the agreed upon formats? So again, if it is like electronic medical record system implementation, so there is a way for patients to move from one department to the other, right? So first there has to be triage, and then after the triage, then the patient will go to the registration, and then all the demographic information will be registered in the patient registration or medical record unit. And then later it can be, that patient can be sent to OPD for further examination, for diagnosis and the treatment. So this kind of procedure need to be documented. And the last key components of the disposition checklist is equipment disposition. Has all electronic media been sanitized as appropriate for assigned system information security categorization and recycled or reused, whether there is a reuse plan or not? Has the media sanitation been validated and documented? Have the hardware and software resources dedicated to information system been completely documented? is a reuse or recycling or destruction plan documented for all system hardware and software resources. So we could use several softwares and hardware to develop a project. If the project is system, then we may use different hardwares and software. So we have to provide necessary information for that. So that is the checklist. I think it is very essential to consider that checklist. And this is the table of contents outlining the main components of the project disposition. So one thing that we need to have is the disposition planning. So which includes the overview of the project, the scope of the projects, disposition plan and objective point of contact. And then the second key components of the disposition is the transition planning. And then we have to also consider system disposition, which includes data disposition, software disposition, equipment disposition, and documentation disposition. And the last key component is the project close down, which involves, we have to consider the staff that we have and the record management and the facilities that we use. So these are the key components of the project disposition or project closeouts. So now we can take a look at the project closeout templates. Let me just quickly show you the. So this is the template that we need to consider. So as usual, it is similar to other key phases of the HIS project management. So remember, the first phase is the just to have the overview, and the first one is the preparation phase, and then the next is the planning, and the third one is the design and development. And then yesterday you have learned about the fourth, the fifth, I mean, yes, the fourth phase, which is the project, the testing and implementation. So now it is disposition. So for that, it has its own templates, just like the other phases. So here you can indicate the project name and the disposition plan and the version that you have, and also the date that this document is prepared. So here it says, I'm not sure whether you can be able to see it. Let me probably increase the font size to 150 so that it can be more visible. So here it says this template is intended to guide planning for ending health information system project. It supports planning how the system will be transitioned to core stakeholders or shut down, and is based on minimized impact on stakeholders. See, whether we shut it down, whether we deliver it to the key stakeholders. So we have to have, this documentation so that we can be guided well. So this is the version history, just like other phases. And if you want to know more about the toolkits, so here we have, the purple colored text so we can read. And this is where we are, project closeouts. And here we have acknowledgement for the preparation of this document, I think. And the like. This is the disposition checklist, as I mentioned. And this is the table of contents and the disposition planning. We have an overview here. So in this case, we have to provide a brief description of the information system and reference the high level functionality provided by the system. This will help highlight what functions will no longer be available to the end users of the system. So we have to provide appropriate overview or description. And then the next part is a brief description of the business and technical reasons why this information system should be sunset. Indicate any alternative sources to the same functionality if there is any. So we have to provide the scope And objective, it has to be clear. And we have to have also a point of contact. Okay, names of stakeholders, their roles, organizations, and contact information of those people who will participate in this in the disposition phase and serve as point of contact for the system disposition. So we have to provide any point of contact. So be it in health information system or in any other projects. So I think we can make use of this template for project closeouts. Yesterday, one of the trainee asked, I think it was yesterday or the day before yesterday, one of the trainee asked whether we can be able to use this template for any other project other than health information system. So the answer is yes, definitely we can be able to use, but we have to contextualize it to the project context. So that's really the most important part. Other than that, as you can see, it is really very well prepared, well documented, structured, so that it is easy and straightforward. Anyone can easily understand it. So if there is, people moving outside this project or leaving the project due to different reasons, then if there is new individuals assigned to the project, then they can read this template and they can understand it easily. So this is really it's really very important. So we can be able to use it for other projects as well. So this is the template. I think it is about, I'm not sure, 20 or 9 page. It has 9 pages, so you can be able to use it. Remember, when we add descriptions, then the number of pages will be increased. Now let's proceed to the disposition planning. Excuse me. So to plan for a project closeout, the first section asks you to describe the health information system, which I mentioned before, which is about the overview, the scope, the objective, and the point of contact. So all these things need to be included in the templates. So the scope part asks you to provide a brief description of the business or the technical reason why this HIS should be ended. So older technology as an example, or additional maintenance or security risk, or end of the project. So if it is, if we need to close out the project, so we have to provide the appropriate reason, okay? So we may close a project due to different reasons. One, because of the older technology. Two, if there is any need to have additional maintenance, then we may close the project, or security or risks, security risks. Or if there is an end point for the entire project, then we can provide a reason. And the objective provide a brief description of what you hope to accomplish within the scope of the key disposition tasks. For example, transition planning, component disposal, media sanitization, or information archiving. So there could be the different reasons or objectives for the disposition planning. So we need to include under the objective. And for the point of contact, I think I have already discussed this. We need to provide the names, the contacts, the role, and the organization information of those people who will participate in the disposition phase and serve as points of contact for the system disposition. So we need to include this. Coming to the transition planning. So now let's cover the transition planning. Here we have a subcomponent, which is the stakeholder impact and notifications and the communications. So here we need to provide a brief description of how stakeholders or end users may be impacted by the loss of functionality from the disposition of this information system. Okay. So if we are supposed to dispose the project, then we need to discuss, how stakeholders and end users can be impacted, and any proposed workaround solutions. So we need to include any technical dependencies with other systems that may need to be mitigated. So this is very important. We are talking about here project disposition. So in that case, we have to have appropriate transition planning, and we have to indicate the stakeholders' impact and the end users' impact. So the second one is the notification and communications. So this section describes the plan for notifying non-users of the system being shut down and other affected parties, such as those responsible for other interfacing systems and operations staff members involved in running the system. I think just to describe this further or to explain it further, for instance, in our hospital where I'm currently working in, which is a university-based hospital. So we are implementing electronic medical record system, and there are several old systems that are being used. So in order to implement the new one, so we have to dispose the older one. So here we have to notify the end users and also the stakeholders and how they can be impacted. Okay. And we have to notify them. We have to communicate them clearly. Okay. So for instance, and in Tolosa raised his hand. Okay. So Tolosa, I'm going to unmute you so you can, I'm going to allow you to talk so you can unmute yourself and you can raise your point. So in the middle of the discussion, if you have any questions, just let me know. You can raise your hand and then I can allow you to unmute yourself and talk, okay? Tolosa? Hi, Tolosa, can you unmute yourself? If not, I'm going to lower your hand and then we can continue. If you accidentally, okay. Permission to talk, okay. So, yeah, so that is the case. If there are old systems, for instance, in Ethiopia, smart care has been implemented for years, and it is being used in medical record units as well as in the ART for HIV care. So if we are replacing this system with a new one, then we have to provide appropriate communications and we have to identify the impacts, okay? The second key components of the project closeout is the system disposition. So this section describes specifics for how system will be disposed. One is describe the plan for archiving, deleting, migrating the data files to other systems from the system being shut down. The plan should also include a section on how the data will be sanitized if applicable. So that is for the case of data disposition. So for instance, in our case, again, we are implementing a new electronic medical record system in our hospital. So there was an older software, which is the smart care. So before we start to implement the new system in the medical record unit, so we have to migrate the data from the older to the new one. So that later, so we can dispose, the data. And the other one, software disposition, describe the plan for archiving, deleting, migrating the software library files to other systems from the system being shut down. Yeah, so we have to do that. And there is also another software which is implemented in the laboratory department, in the diagnostic department, which is the polyclinic. I'm not sure most of the colleagues here, the trainees here are familiar with this system, and it is the old one. It's a Windows-based system. So if this system is supposed to be altered and a new system is planned to be implemented, then we have to dispose the software, but appropriate planning should be made. And the other one is equipment disposition. If there are anything in relation to the system disposition, so we have to dispose that as well. Documentation disposition, describe the plan for archiving, deleting, and transferring to other systems. So this is what you call it, the system disposition. We have to consider the data, the software, the equipment, and the documentation disposition. And yeah, this is just to provide additional description about how we can be able to dispose data, software, equipment, and the documentation. It's all similar. And the other one is the project close outs. So here we need to consider the project stuff, the record management, and the facilities. For instance, for the project stuff, we need to describe the plan for notifying project team members of the shutdown of the system and the transfer of these team members to other projects. So for the Polytech system, which is a laboratory system, and as I said, it is an old system, and it is a Windows-based system, and we need to replace it with a web-based system with a new one. So there are several project staff who are really working on this old system. So there are people from the Ethiopian Public Health Institute who came to rectify if there are any issue about the system, and if it is broken down, and then this project staff comes to the hospital, and then they come to maintain it. So if we're supposed to shut down this old system, then we have to communicate with the project staff that we are replacing with a new one. We are shutting it down. So we have to do that. And the second one, record management. Here we need to describe the plan for record management, including the plan for archiving, deleting, or transferring to other projects. The records of the project activity for the project that has been maintained, the system being shut down. So yeah, we have to consider also the record management. We have to transfer the records, and we have to archive it, and then we need to delete it also from the older system. Describe the plan for transferring or disposing of facilities used by the project staff for the system being shut down. So there are there could be several facilities being used by the older system. So in that case, we need to check it. We need to describe the plan for transferring or disposing facilities. For instance, here at the University of Gondar Hospital, there is a Polytech system being used at the laboratory, and then there are different facilities used in that laboratory, like barcode and computers, barcode reader, as well as barcode printers. So we have to have a way to transfer or dispose these kind of facilities. If we supposed to use them for the new system, then we can transfer it. But if no use, then we can dispose it. So now let's have a quick discussion. What other consideration for health information system disposition plan or project closeout process that we may consider? So here, if you are comfortable, you can put your insights to the chat box. But if you are also comfortable to speak, then I can allow you to talk and you can unmute yourself and then you can discuss. So I give you a few minutes. Anyone who is interested to discuss any other consideration other than what we have discussed, that can be considered for health information system project disposition plan or project closeout. I can allow you to talk if you can raise your hand. Khalid, thank you for your interest to share your experience or some other considerations. So please go ahead. You can unmute yourself.
Good afternoon, everyone.
Hi, Khalid. Good afternoon.
I'm really very happy to attend this wonderful session. And I want to thank everyone who participated and also all our presenters, doctors, professors, and everyone who give us a hand to communicate, to share our experience about the health information system. But I have only one consideration. If you as these project coordinators to give us another opportunity to attend like another information system like waterfall. This one mostly was agile, isn't it?
Yeah.
Mostly this one was agile. So
yeah,
I would like
most health information system projects are agile, as you said. Yeah.
So as a knowledge and the concept, I would like another another session of waterfall system. Thank you very much.
Okay.
Khalid from Somalia.
Thank you so much, Khalid, for joining us, one, and for your reflection, second. Yeah, so really appreciate it. He's giving us comments for other considerations like waterfall kind of system development methodology. So yeah, definitely we may consider in the future. But you know, most health information systems follow agile kind of system development methodology due to the nature of, you know, health information systems. So we gather requirements and then we design it and we develop a system and then we check it. If there is new requirement, then we again in a kind of cyclic fashion. So we have to improve the system until all the requirements are fulfilled. So that is the nature. But if there are market-based health information systems where you can only develop the system once, in that case, we may follow the waterfall, a kind of top-down kind of development, hierarchical kind of development, and then we can finalize the project in such a way. So both of them, they do have their own strengths and limitations. So I think depending on the nature of the project, we can follow this. Q&A. Yeah, if you have any questions again, you can also add it the Q&A part so that I can respond that later. Yeah. Any more comment or feedback? Okay, here during the closeout, good to have plan how the project will sustain afterwards, anticipating the challenges, preparing the skilled and trained human power, data storage and backup. So thank you, Adisalem, for your comments here. If we close out or disposing means we're just shutting down the system, the older system, so that it can be replaced by the new one. So you develop a system and then you provide support and maintenance for a certain time. And if that project needs to be closed, then what are the ways to close it? And we need to have an appropriate plan. That's what we are discussing right now. So here, if we close out, good to have plan how the project will sustain afterward. There's no we are closing it down. So we are not thinking about, sustaining that specific project, but we can replace it with a new one. Brahanu Yeshano, I was layman for this subject, enrolled into this course to get an insight. I think I have achieved my objective. Thank you for your comments, Brahanu, really appreciate it. Leah Taye, Leah, thank you for joining us today, as well as for providing your inputs. When closing out a health information system, plan or project, several key considerations should be taken into account to ensure a smooth transition and sustainable operations. Here are some important aspects to consider: data management, stakeholder communication, training and support, system handover. System handover, regulatory and compliance, sustainability and maintenance issue, archiving and knowledge transfer. So all these things need to be considered when closing out a project. By considering these aspects, we can help ensure that the information flow closes out effectively with all necessary components in place for system continued success. And thank you so much, Leah, again, for your comments. I think a lot of people can also see these comments. We have to consider interoperability issue with the new planned system, definitely. If there is a new system, yesterday also there was a comment from one of the participants. So whenever we are developing systems, so we have to consider the interoperability issues. One thing that I would like to share with you, when we want to integrate several systems here at the University of Gondar that we faced, for instance, we have student information system, we have alumni system, we have journal system, we have a lot of, we have also ethics application management system developed using open source. So we want to integrate all these systems to using API so that we can have one login for all the systems. So for instance, if I log in with from the dashboard, then I can be able to access my email, the ethics system. I don't have to log in it again if I log in once. But you know what happened? Some of the systems which were developed, they don't have API. So it was impossible for us to integrate it with other systems. So whenever we are thinking of developing a system, make sure that we consider that system for interoperability. So for that, to have policy and standards, available policy and standards. Okay, so we need to think of whether there is existing policies and standards before we start to develop a system so that we can ensure interoperability. And Libsuye, thank you so much for bringing this interoperability issue. Yeah, I think Tadele Chekol mentioned that a year ago, many project Tadele Chekol is here from the University of Gondar. Thank you for sharing your opinion. A year ago, many projects were implemented like smart care, electronic health management information system, IVR, HRIS by the aid of NGO partners, but we could not consistent the system. We couldn't be able to sustain it, I think what you mean. When partners out, the system also out. So how to work with systems to avoid this failure? This is very important. So to avoid this failure, we need to critically plan. So that is the most important thing. So the planning or having this toolkit is really useful so that we may not have failure. We can avoid failurity. So we need to have preparation phase. We need to have planning phase. We need to have design and development. We have to be also part of the design and development. Remember, involving end users during design and development, during planning, during preparation. So all these things need to be considered. So once you have all this in place, once you have all the necessary information in the toolkit, then there is less chance for a project to fail, I guess. I really appreciate this online training. Thank you so much for insight and concept to provide us on fundamentals of project planning management considering HIS. That is by Rebuma. Thank you so much. If I mispronounce your name, please forgive me. But I really appreciate you being here and also commenting. Another point maybe to consider is conduct a risk assessment to identify potential risks associated with data disposal and implement measures to mitigate identified risks. That's very true. So yesterday and the day before yesterday, even during the preparation phase, I had a discussion with you, the need to have risk assessments. Okay, so that is really important. So we have to consider risks, potential risks during the planning phase. So that is the point I discussed the day before yesterday, I guess. Shamsu, really, I'm happy with the training session because I got lots of updates from the usual lead. Thank you, doctor, and thank you so much, Shamsu. Really appreciate it. Thank you, Abebe Gadam, Abebe Dabesa. Really appreciate it. Let me show you once again the project management toolkit, and then we can finalize this session. Okay, Melese and Robel, please wait for a moment. I will give you the chance to speak. So, so this is the toolkit. It has everything what we discussed since Monday. So here we have the HIS Project Management Toolkit table of content, having introduction, project description, not only for each phase of the project. So if you need introduction, then you can read the executive summary from the project preparation and introduction for the project plan. So you can have the purpose of the project management plan and overview of project and product overview. So you can read this, and it has template, remember. So if I click this template, then automatically I can be able to access the template for project plan. And for project preparation, if I click this, then I can be able to access, the template for project preparation. And the same is true for design and development. It has its own templates. So this is the links it is unique. And for testing and implementation, it has, again, a project template where you need to put everything in relation to testing and implementation, okay? And, oh, sorry. And for project transition, we can have, the template here. And for final product overview and annual operation checklist. So this one also, we can have, the template so that it can give us an insight on what to do in relation to each phase of the project management. So that is the link. The second one is introduction. So for each phases, you can have introduction. And the third is project description. So for each goal and overview, project information, financial consideration. But for project business requirements and definition of success as as a project description in the project plan. And the same planning phase. And also we have to have project requirements for Hi, everyone. I'm sorry that I was interrupted. I didn't see it where I stopped even. So it would be great if either Rabi or Samuel could tell me where I stopped.
Yeah, no, it's fine. I was thinking that the problem is from my side. Sorry.
Okay.
Yeah.
Okay.
Yeah.
Okay. So what I was saying is there is table of contents. For each table of content, there is a corresponding information for each phase of project management. So we can take a look at that. So the Health Information System Project Management Toolkit has everything in it. All the necessary documents and templates are available. And here we have also the tool pack overview. Budget, we have a template here. Gantt chart, we have a template here. And as an example, there is a Gantt chart example. You can access it here. Project risk issues, change log, you can have it here. Requirements, you can have it here. Hardware inventory, because for requirement gathering, you need to have a template. So that template will guide you on how to access, gather requirements. Hardware inventory, you can access it. Site preparedness checklist, you can have it here. Project management software guide, you can have it here. Okay. And there are CDC specific project plan templates. If there is a need, you can adopt it to your context and then you can access it here. Okay. And the purpose already included here. And each phase of the project management, you can access it here. For instance, you need to have budget consideration for the prepare and planning phase, but you don't have to discuss it during the design, development, and test and the like. So the budget plan will be, there is high level budget consideration here for the preparation phase, but for the entire project plan, you can have a detailed project.
I can't hear you.
Really?
Can you hear me, Dr. Tesfahun?
Yeah,
It's
I can hear you very well. Probably anyone else who can hear me, you can raise your hand. Can you hear me?
Yes,
okay,
it's audible.
Okay, thank you so
Yes.
much.
Okay.
That means it is from Samuel's side, I guess.
Yeah, that's the connection probably. Okay.
Yeah, okay. So Yeah, so this color indicates something, okay? It has its own purpose. So each of the template names, there are templates. This one is templates names, and this is the specific links to each template, and then how these templates are related with each phase of the entire project management. So that is the color, okay? Yeah, some of the CDC specific project plan template, you can access it here, okay? And you see, this is the budget template. For instance, if I click this, automatically it has to switch me to this phase, okay? See how it is switched from the toolpack overview to the budget? So that means this is a template which can be available here. And this is for the Gantt chart and Gantt chart example, project risk issue, requirements, okay? So the requirements, we have discussed it in detail last time. Hardware inventory, where you can make an inventory for each hardware, and site preparedness checklist. Also, you can have this template, and project management software guide. Everything you can also access here. Okay, so I will be providing this HIS Project Management Toolkit for you guys, so you can access it. I will give you the link, and then you can access it. Make sure that you you acknowledge or provide appropriate acknowledgements for PEPFAR and the CDC, who sponsored the development of this toolpack, and also JMB has significantly contributed on this. Yeah, so having said this, now we can go to the Q&A, and also, okay, Q&A, I can access it here. Okay. Araya, are we going to dispose the data after migrating it to the new system, or shall we put a backup for further? Thank you so much, Araya, and happy that you follow up this course. I really appreciate it. And I would like to say also congratulations for you, Araya, that you will be defending your PhD thesis soon. So this is really great success, and congrats. So concerning your question, yeah, we shouldn't leave all the data behind with the software being closed or the project being closed. So we need to transfer it to the new system. And at the same time, we shall take also backup. Definitely, we need to, you never know what will happen with the new system, okay? Because we are introducing, we are implementing it. So there could be some uncertainty. So we need to have backup. Always having backup, not only for all the systems, but also, for the existing one, we need to have also backup. Okay. If you have any additional opinion area, you can also raise your hand. You can reflect it. In our context, there seems a challenge during resource release in the disposition phase, like resource and staff reallocation to other projects. What is your view on this? Yeah, resource release. Yeah, we have problems, but I think we need to prepare them for the new project or for the new system as well. One thing that I remember was, when I was just like few years back, I was trying to implement medical record, electronic medical record system to the University of Gondar Hospital. So it was some times ago. And that system was Windows based. You can guess how old that system can be. And then, we had a meeting with the entire hospital team, and they asked me, I was debriefing, about the new system, how it looks like, and who will be involving, and the like things. And there was one lady from my neighborhood, and then she asked me whether I'm going to fire her because of the new duty that I will be assigning, because she thinks that she used to work, with the manual system, but it is a computerized. Now that manual system is gonna be replaced with a computerized system. So she has to make herself ready. Otherwise, if she's not be able to work with the new system, then she thinks that she's going to be fired. So she was really angry at me, and she was asking me this question. And then I said, no, madam, you're not going to be fired. We'll really try to put effort, and we'll train you, and to ensure that you are going to use the system very well, just like how you operate, during the manual system. So that was my reflection. So yeah, appropriate resource allocation should be made, and the staff reallocation has to be also made. So we have to provide capacity building activities for the new system. Anonymous attendee, I'm using a mobile that is not mine. Would I still be considered as participants? Not sure what that means. Participants? I think it is what you want to say, right? Anonymous attendee, I would like to let you know that appropriate attendance might not be taken if you join with anonymous. So make sure that you use the right link to join us. So I understand that you are Yasin from the University of Gondar. So please remember, you need to log in with the link that you have been provided with. Could you comment on the human resource development in this area, health information system in Ethiopia? The attention it gets from stakeholders like Federal Ministry of Health and Ministry of Education. Addis Alam Dababa, thank you so much for your question, and thank you also for joining us today. It's really hard for me to comment on this, but what I know I can reflect. Human resource development. I think we are these days we are doing well, I can say, in relation to producing health informatics professionals in Ethiopia. And I believe that here at the University of Gondar, we are, I can say, pioneer. We do have advanced degree, advanced degree, master's, PhD, and we started just a postdoctoral program as well. So we are still producing competent health informaticians who will be engaged in several health information system projects and health information systems in Ethiopia. And we always do consult the Federal Ministry of Health. We are working with the Federal Ministry of Health, not only actually the University of Gondar. Health informatics curriculum or program is being offered in other universities as well. So there was human resource assessment, which was done by the University of Gondar in collaboration with the Ministry of Health. So I suggest I can share you that documentation, and you can be able to obtain detailed information about the resource, the human resource development in Ethiopia. And there are also other developments which I currently don't remember, but I think in relation to health information system, I can say that we do have we are in the right track to have human resource. But the technical aspect is lacking. That is one thing that I cannot deny. So we need to have practical exposure on health information system development and the like. So that's for that the ministry and all the universities need to work hard so that appropriate technical capability can be ensured. Thank you, Zoe Adisalam. We can also chat privately if you need more on the resource development, actually. Yeah. Alkidan Kasai, can this toolkit be adopted or other projects? Definitely, you can adopt it to other projects other than health information system. This is what I keep on responding yesterday as well as today. Anonymous attendee, if one project is closed, who is responsible to plan or rebuild to the new project or system? Yeah, the reason why we are closing a project I mentioned already. So either because we need to deploy a new system, or we need to close the old, we need to close the project because of the old technologies, or because of maintenance issue and other reasons. So if there is a need to have a new project, then a new system projects and new health information system projects need to be considering all the phases of the HIS project management, the preparation, the planning, and everything. Theodros, hope all materials will be shared, definitely. Is there any successful capacity development and training like this? Is there any successive? We're going to discuss this with the Ministry of Health. Currently, we just have it, all the documentation with us, but in the future, probably next year, we are planning to release it, make it, online, so that there could be self-paced, of taking this course, and then we will prepare kind of exam for each chapter, as well as the final evaluation. And then if you manage to score 80% and above, then you can be provided with a certificate. So we are considering that. We are discussing this issue with the ministry. So hopefully next year we can be able to provide this. Who can be health information system project manager? Is there any restriction? Anyone who would like to reflect? I would like to hear from you. Who can be health information system project manager? Anyone who is familiar would like to reflect? You can also respond on the chat. Okay, health professionals, you mean medical doctors, nurses? Okay, anyone else? Fantastic, thank you. Health information system projects. Computer science, information system, health informatics. Taklit, thank you. Really appreciate it. HI 100%. Tesfahun. HI stands for health informatics, I'm assuming. Health science student, health science professionals can be also, okay. Health informatics, statisticians can be to me. Health informatics, always the background and technical expertise. That is what I agreed. I agreed with Yared Tadasa. Thank you so much. Yeah. As far as you have some technical background, whether you are a medical doctor or nurses or whomever, so you can, I believe, mathematicians. Wow, pound. Mathematicians can be health informatics system projects if they do have some sort of technical background, why not, to me. Epidemiologists can be also HIS project managers if they do have some sort of background and also leadership skill. Actually, leadership needs to be also considered. I am assuming that during our undergraduate program, we at least took introduction to management, right? So when I was undergraduate student in my undergraduate program, I took like personal management, market. For my case, it's, I think, different types of management, including project management. I have learned about project management as well. So if you do have exposure to leadership or management as well as technical aspects, then you can be able to project manager. Sarah, thank you for your question, but I don't think there is a restriction to me. Araya, again, for system implementation, sustainability, system handover is very crucial strategy. Hence, is there a system handover strategy included in this project toolkit? System handover, I believe there is. Let me just check back the product overview, final product overview. I think, let me try to see. Okay, just give me a moment. Okay. Yeah, toolpack, final product overview, node operation, toolpack template. Let me check the template. I remember that, when we prepared this template, PowerPoint, we have a handover issue, but I don't exactly remember where we included that. But we can, we have everything in the toolpack. So we may consider, the templates, enterprise security and recommendation, product handover. I remember there is a section where a product overview is indicated and the step-by-step. Yeah. So probably for the interest of time, I will continue with the questions. But Araya, thank you for bringing this question to us. But there is, I think, a way to hand over projects. But if you remember, during the first day, I mentioned about handover planning. Yeah, that is, I think, where let me check the PowerPoint. Handover planning, final products handover. So let me quickly see the table of contents. Where is the table of content? I think it was in the preparation phase. In the preparation phase, there was yeah, here you go. There was a plan for handover, so you have to plan it at the beginning. And there is a strategy for sure. So I discuss about that. So we can refer back to the project's preparation and project planning phase, where we discuss about the handover issue for the final products, okay? How we can be able to plan it. So the strategy is just, it's just the plan area, but I'm happy that you raised this issue. Okay, Johannes Hub 2, I believe during disposition of an old intervention, we better follow the de-implementation research steps and frameworks rather than just disposing it fastly. Definitely not sure though whether we need to conduct a research, implementation research, you said. Implementation, de-implementation research steps. Thank you, John, for bringing this. Yeah, there is a strategy which is included here in the toolpack. But if it is like a complex project, we may consider, the implementation research steps so that we make sure that nothing will be missed. Yeah, in any case, we shouldn't dispose it fast. Okay, there is a step-by-step procedure. That's why we need to have the template. Okay, so we have to bear that in mind. But I am happy that you bring it here, Johannes. Befekadu, based on what I have seen from the presentation, anyone can have skill, project management skill. Definitely. Thank you, Befekadu. Based on what I have seen from the presentation, anyone can have skill, project management. If I understood you correctly, you are mentioning, you are saying that anyone can have project management skill, but there has to be appropriate. Yeah, from this, I believe you have learned a lot about the each phase of project management. So you need to engage yourself practically for projects to ensure that you have the skill. Okay, further. But now we are transferring, the knowledge or experience on how you can manage projects, especially health information system. But practical exposure should be there, for project management. How you can be able to, for instance, last time it was Zanti or someone else who was providing, the project management software demonstration on project management software. That is a skill. So you need to expose yourself to ensure that you know it very well. So the trainer provided you with the demonstration, but later it should be up to you to make yourself familiar with that software again for further. I think those are the questions that I currently see, and I really appreciate that you forwarded these questions. Now let me give. Oh, there are more questions? No. Okay. So if you have any more questions, Tababu has raised this. First, let me give to Melese. Melese, you can unmute yourself and then you can speak. Tababu, I will give you later. Maru, I will give you also.
Okay. Thank you, Doctor. Can you hear me?
Yeah, I can hear you very well.
Okay. Thank you very much, really. I'm really very interested for having such kind of training. I'm really happy on the courses, and I took so many things from the training. Maybe one thing that I want to add from here is just on the HIS disposition plan. So maybe in my perception, in one disposition plan, evaluation is mandatory. So maybe conducting comprehensive evaluation for one project is very essential, so as to take the lesson and so as to identify the success, so as to identify the challenges, and so as to take lessons learned. So as part of just disposition plan, we need to consider the evaluation. Activity, as per my understanding. If I'm not mistaken,
You are really
I'm
right.
not-
You are
yeah.
really right, Melese. So evaluation should come first before we even decide to close the project. So the
Exactly.
first step should be the evaluation so that we can learn lessons, right? What
Yeah.
has worked and what has not worked. So we have to identify that before we move to the closure. Okay, thank you.
Thank you very much.
Yeah, that's all. Sorry, I interrupted you.
No, I don't have any other suggestion.
Thank you so much. Really appreciate it, Melese, for bringing this. Evaluation should be done. So this evaluation, you can consider like research or simply simple evaluations of a project can be considered so that we can learn what has worked well, what has not. So this is important. I thank you so much, Melese, for bringing this. Sababu, you can go ahead next. Let me unmute you for allow you to talk to talk. Okay, go ahead. Sababu is from the University of Gondar Hospital here. Sababu, I have already allowed you to talk, so you can unmute yourself and you can ask your question or comments.
ራስን አንሚዩት እንድታደርግ እንትን
Melese, if you are done with your comment, you can mute yourself. Yeah, thank you. Sababu, would you like to proceed? If not, I would like to show you one more issue and then we can wrap up this session. Okay. Okay, so now I would like to show you this. So this is the Ethiopian Digital as Interoperability Network. So using this chance, I would like to introduce you the Ethiopian Digital as Interoperability Network that we established as a national. So if you'd like, you can be a member, you can register yourself here and you can join our community. So it is a community of practice. Anyone can join and then contribute. And we have an academy for this. For instance, if you click this academy, then you can see academy.edhin. EDHIN is Ethiopian Digital Interoperability Network. And under the University of Gondar, we have Center of Excellence for Interoperability and Center of Excellence, I mean, for interoperability. And we have the academy. And so far we have developed 2 courses which you can take by yourself for free, okay? One is Introduction to Interoperability and Enterprise Architecture 1, and the other one is Introduction to Interoperability and Enterprise Architecture 2. So this is more advanced. So what you can do is just you click it, and then you can log in. Click. Sorry. And then you can start taking the course. So here we have a left panel where you can see the table of content. We have here general information. So, and you can also get certificates. Currently, it's not available because I didn't take the course. But if you have already taken the course, then and if you score more than 80% of the evaluation, the final exam, then you can be able to download, the course certificate. It's really important to have this. So the reason why established Ethiopian Digital as Interoperability Network is just to create capacity for the ministry, for the national consumption, as well as for various stakeholders, so that we can successfully implement interoperability in our country and also in health facilities. So so this is the second, I guess, yeah, the second course, which is more advanced. And then just to show you around, You can have general information. And the way the courses are organized, it's kind of a blended way, meaning there are texts, graphs, and also videos that you can take, that you can consider. We used kind of AI, to read the transcripts or scripts. Do you want to start at this page? Yes. And then, as you can see, you can hear the video, and then there are also ways of explaining things using texts and graphs. I think it is pretty much nice. We have done some good job here. I'm not sure whether you can be able to hear. Yeah, anyway, so this is another thing that you can consider. In the future, we are planning to have this kind of course online so that people can take the course just independently by themselves without any moderator or facilitator. So in the future, we'll be planning to have this course. That's what I would like to mention. So feel free to learn or to disseminate this information to your colleagues about these two courses. Okay, so let me see your reflection. Okay, thank you, Dr. to explain EDHIN and invite to join this community. Please join the community. We will be conducting series of webinars and also national level conferences in the future. But at this time, it is at the infant stage, but hopefully we'll make it really stronger. So this is important. And we have to also provide ownership to the Ethiopian Health Informatics Association so that it can be sustained, It's great initiative. I don't get that part. Alade, if you'd like to voice over, then I can allow you to talk and then you can raise your issue. Alade, if you didn't get the point. How do I join the community? It's easy. The community, let me click home. So the website is edhin.org. It is a community of practice. It's not an association. It is a community of practice where anyone can join and contribute. So it has forum, by the way, if you'd like to discuss in the forum. And it has also a wiki that we have developed. So you can take a look at it and you can raise any issue in relation to interoperability. And then others also can raise. So this is the wiki. And the other one is the forum. Okay, at this time, since we are introducing this, there is no any forum, but you can log in and then create any issue that you want. So the community, the way to join is just register and join here, edhin.org, then you can click it here. Okay. Okay, Q&A. Is there anything new? No, right? Anyone who'd like to reflect as a final thought? Eob, let me allow you to talk and then you can unmute yourself and raise any issue you want. Eob? So if you accidentally raise your hand, you can lower it. Okay. Message from the message box. Let me check. Thank you for sharing. Thank you. Okay, Academy Dechen. Thank you, Ared, for sharing that. Thank you, Adisu, as well. Thank you, Shegao. Yeah. So I think that's all from my side. Sorry, I took long time than expected. I thank you so much, Samuel, for the facilitation and Abby for really organizing this event. And I also thank, the Ohio State University or the Global One Health Summer Institute for arranging this kind of, actually there are several other courses that you can take under the Ohio, Global One. If you simply Google Global One Health, One Health Summer Institute, you can have more courses for 2024. As you can see, online courses, one is Health Information System, which we have done today. And there are also other upcoming courses that you can register and take. I think this is a very good opportunity. So it doesn't have to be only Health Information System, but you can take other courses like, for instance, data processing, data summarization, machine learning in the era of generative AI. So that one is from August 26 to 29 by Dawit Mulugeta. And research ethics for One Health research and the like. So you can explore more. If you want, again, you can also go back and see the previous courses as well, I guess. That's all from my side. I thank you again, JMB Health System, Tariro, really appreciate it for organizing your team and delivering the course. I think Tariro has left, but this is really a great collaboration among JMB Health System, Ohio State University, and also the University of Gondar Centers for Digital Health and Implementation Science. I thank you so much all for your attendance. Over to you, Samuel.
And thank you, Dr. Tesfahun. I really appreciate for your insightful presentations, the experience on health information system project management. Thank you all attendees for your active participation. So as Dr. Tesfahun mentioned, Ohio State Global One Health Summer Institutes will take place till September, and there are several different courses to build the capacities of One Health. So kindly invited to register and attend other courses also. Thank you very much.
Yeah, for the certificate, we'll be providing that once we evaluate, the participation and the attendance, and then we have your email. Make sure that you included your full name. I'm assuming that you have already registered yourself using your full name. So based on that information, we'll be providing the certificate. Yeah.
Great, thank you. Abi, if you have any comments, let me give you a chance to you.
Dr. Tesfahun, thank you very much, Sami and Dr. Tesfahun and all participants. I encourage you to register also for other Global One Health Summer Institute courses, which will be resuming beginning from next week as well. I'll be giving the attendance accordingly with your full name. And as Dr. Tesfahun already explained, they will be providing certificate based on that. Thank you very much.
Thank you very much. Our course is completed. Thank you. Bye.
Thank you, everyone. Thanks so much.
Thank
Bye.
you so much.
Thank you very much.
Bye.